hospital, they do all the investigations, they do all the vitals, apart from the fact that the pulse rate may be elevated, blood pressure may be elevated, which will be elevated when someone is anxious, so all that is elevated, but every other thing is basically normal. Even though the person is telling you they can't breathe, their SpO2.
So there's intense pain here, is there?
No, there's usually not intense pain. There is just a chest discomfort, as against a heart attack, where there's usually like an intense pain that is increasing, and it's usually worsened. That's for heart attacks. It's usually now it's not a diagnosis one should play with and say, okay, am I having a heart attack? Am I having a panic disorder? It's best just go to the hospital and let them find out. But subtle differences is the fact that with a heart attack, there's intense pain that's increasing. The pain is radiating from the chest to the arms, to the neck. With panic disorder, there's a discomfort in the chest. There's a tightness the individual feels instead, but not necessarily radiating anywhere.
But I have to ask, is this life-threatening?
Panic disorder is extremely uncomfortable, but it's not life-threatening.
What would cause somebody to be so panic-gripped?
Yeah. When we look at the etiology, the causes, there are various factors. There's no clear-cut known factor, but however, it has been clearly noted to be genetic. In fact, the probability of inheritance, genetic inheritance, about 40%. So people with this condition often have someone else in their family that has a similar condition. It may even be that the other individual was not diagnosed to have a panic disorder, because the person will just say, I have this sickness, this constant sickness. Someone will say, I'm just constantly going to the hospital. So most times the picture you see is somebody who's constantly visiting the emergency.
And sometimes these people are not diagnosed throughout lifetime.
Yes. Sometimes they can be misdiagnosed, and also because of many factors. I have seen patients who, even when they are told it's a panic disorder, keep insisting that, no, I have a physical condition. This level of discomfort.
Because the symptoms are so physical.
Yeah, they are physical. No doubt. They are physical. But the fact is that in the face of investigations that do not show there's anything wrong with your heart, that should begin to inform that it's possible that what you have is a panic disorder, especially when you are taken through the list of symptoms and you confirm that, yes, I have them. But
is there no trigger? What are the things that set it off?
There are various situations. Largely, there's the non-situational panic disorder. That means it just comes up on its own. Because underlying it is like saying that the trigger, I like to simply explain it this way, that it's like saying the alarm, the natural alarm that we have that helps us in a threatening situation has become faulty. So, sometimes in a house you have a bell just ringing.
It just keeps ringing.
Exactly. So in individuals like this, they have become kind of hypersensitive. Usually you have a background in many people who suffer from these conditions, of people who already have a tendency to worry, even before they started having panic disorders. So they already have a history. Oh, this person tends to worry. But that is not always the case. So you can have a background of someone who never really had that kind of premorbid personality, but having a panic attack.
So that means it could just come for no reason.
Yeah, so it comes up for no reason, just like that. But like we said, there's a genetic factor. Sometimes it comes up during periods of stress. So someone is going through a stressful period in their life. Sometimes one has gone through a stressful, so it may be I'm going through, or I have just gone through one. Like it occurs in PTSD, post-traumatic stress disorders. So people later on develop panic. And then it also sometimes occurs in cases of maybe someone already has an established phobia. For example, some have fear flying.
Fear of heights?
Yeah, fear of heights. So they already have that before. Now, in those situations, they now have a panic attack. And I think it's also important to differentiate a panic attack from a panic disorder.
Okay, so what's the difference?
Really, so one could have a panic attack, but not necessarily progress to have a panic disorder. So a panic attack is like having a one-off period where you went into an intense alarm that I'm dying or something.
Just once in their lifetime.
Yes, exactly, once in a lifetime. But a panic disorder is now when someone has had a panic attack and he has had repeated panic attacks in 4 weeks, at least about 4 times. Or even if he has not had repeated panic attacks 4 times in 4 weeks. Now that doesn't necessarily mean once weekly. It could be 1, 2 in a week, okay. 2 weeks later, but it's just that 4 weeks, 4 times. That's what is important to note. Or it could be that sometimes he has had only 1 panic attack, but then the fear, the intense fear of having another one. So they have what we call an anticipatory anxiety. There is this, oh, I don't want to have that. I don't want that to occur again. So if someone has had a panic attack and is now living in constant fear
of the next one,
yes, one would say that this has progressed because it is now affecting the individual's functioning.
Can one blame upbringing for any of these occurrences?
Well, it's statistics have shown, epidemiology findings have shown that in some cases there are cases of traumatic childhood experiences.
Abuse, for example?
It could be due to abuse, it could be just due to events, maybe a catastrophic event that occurred during this loss of a loved one. Those things are generally associated with anxiety because they tend to make one anxiety prone. They increase one's sensitivity in terms of anxiety. So later on, so it's like having an individual who already is already susceptible, then a life event occurs, then it triggers it. And the life event sometimes could be an illness. So there are people who have had illnesses and along with the illness, a physical illness, maybe like cancer or something else, they now start having panic attacks.
Is there something like a warning signal to show the person that something is coming up,
More often than not, there are no warning signals. But people who have a panic disorder, what they normally will have is an anticipation.
Okay.
So there's no warning signal.
Let's hold it there for a second. We'll take a short break and come back to that. We are taking a very short break now. Stay with us for the rest.